welcome everyone to this community talk of July on breaking barriers in the prevention of adolescent pregnancies for in-school students in Kirehe district in Rwanda. This was a project in collaboration between the University of Rwanda and the University College Louvain-Limburg. So in this talk, we will discuss the experiences of the researchers and lecturers involved in implementing the sexual and reproductive health peer education program in Rwanda high schools as a strategy to prevent teenage pregnancies. So maybe one practical element, you might have seen the messages, but this talk is being recorded so that it can be rewatched in the future. I would also like to welcome very much lecturer Emma Nkurunziza. He's a PhD candidate and assistant lecturer at the University of Rwanda, and he will give us the presentation on these projects. So good luck with the presentation, and very excited to hear more about it.
Hi, everyone. I think you can hear me very well. Can you hear me?
Yes.
Laura,
yes.
is the sound okay? Okay.
Yes, perfect.
Hello, everyone. Thank you very much for joining. My name is Emma Nkurunziza. I'm a PhD candidate at the University of Western Ontario, but also an assistant lecturer at the University of Rwanda. I'm the PI of this project, Breaking Barriers in the Prevention of Adolescent Pregnancies for in-school adolescents in Kirehe district. This was a well-designed peer education program on sexual and reproductive health. So it was designed in collaboration with the University of Rwanda and UCLA from Belgium, and it was funded by VRIR US. So we really thank VRIR for funding our project. Wouldn't have been successful without them, and achieved positive outcomes, and we really thank VRIR. So it's also sorry. I would like also to thank my team, and probably if they are here, they can introduce themselves, what they do, and what they were doing in this project. So we had several tasks. We worked as a team, but there were some specific tasks for everyone in the team. So as you see, I'm here in the white t-shirt. Emma Nkurunziza. I was a PI of the project. Is Justin online? Nadia?
Justin is not online.
Nadia? Olive? I saw her.
I'm there. Hello, everyone. I'm Olive Tengera. I'm a midwife, educator, and I'm a lecturer at University of Rwanda.
Thank you.
Also students. A project.
Thank you so much, Tengera. She's your network. We couldn't hear you very well. She's the head of department, midwifery department at the University of Rwanda, and she was also part of the team as an advisor, but also taking part of the scientific project. So we have also Bosco on the left on the picture.
Good morning, everyone. I'm Jean Bosco Hitayezu. I'm assistant lecturer at University of Rwanda, and I'm working as the assistant lecturer by qualification. I'm a midwife, and also I'm a master's holder in nursing, neonatology. So during this project, we worked from the beginning up to this time. We participated in developing the manual. We also work on the tools. We did data collection. We do most of the steps in the project until now. So I'm here. I'm happy to be with you on this talk. Thank you very much.
Thank you so much, Bosco. We have also Justin. Justin, she's a midwife at the University of Rwanda. During this project, because I was the PI, I left to my for my PhD, so she assumed the responsibilities of the PI while I was here. So we worked hand in hand to make sure that the project is going on well there. So we have also Nadia. She's the head of department of midwifery department in UCL Belgium. Also, she was like in charge of, it's like overall coordinator. So then in front, the small picture you see is Goer. She's also from Belgium, so we started together. But in the middle of the project, she had to leave because she was appointed to another. She had a new job offer, which could not allow her to continue with us. But she continued contributing to other activities of the project. So this project was implemented in Eastern Province, Rwanda, in 3 high schools. So the main outcome of the project, the aim was.
Sorry for disturbing, but you are not sharing the presentation.
Sorry, am I not sharing? What's
No.
happening? Sorry.
No problem. Okay. Now it is.
Oh, I'm very sorry.
No problem.
This is the picture I was talking about. I thought it was there. So these are the members of the team. Starting from white t-shirt, that was me. Next is Justin, Nadia, Oliva, Bosco, and in front is Goer. Ule. This project was implemented in 3 high schools in Kirehe district. The main goal of the project was to contribute to the reduction of teenage pregnancies in Rwanda. So, it's a big challenge. It's a public health concern. And in Rwanda, according to the recent demographic health survey, 5% of teenagers are pregnant or mothers. So that was in 2020, but up to now, an anecdotal report also highlights that it is the teenage pregnancy rate is increasing from day to day. So our specific objectives, first of all, was to empower Kirehe secondary schools students aged between 15 to 19 years old with knowledge, skills about SRH. So we also aimed to develop an evidence-based peer prevention strategy in these schools, as well as also equipping future healthcare workers. We'll talk about these ones, all these specific objectives in details and how we achieved them. So as a methodology, during this project, first of all, as a team, we conducted a literature review to see the existing peer education programs, how they were implemented and the lessons learned in different parts of the world, and how we could build on that literature to inform the development of our peer education program. So then the next step, we had to conduct a networking event with different stakeholders in Kirehe district. This included religious people, teachers, school administrators, local authorities, healthcare professionals, as well as students. So we had a meeting, and the purpose of this meeting, of course, was to explain the project that was coming, but also gathering data regarding SRH context in Kirehe district, as well as their needs, so that to ensure that our project would be sustainable. Then we developed a focus group and we conducted focus group interviews with Kirehe high school students to identify their needs, and as well as for a comprehensive understanding of as well as also to know the context of SRH and the peer education program in Kirehe schools. We also did a baseline survey to assess SRH knowledge and attitudes in Kirehe secondary Kirehe students. So mainly all these activities were to help us to develop an evidence-based, practice-based peer education strategy. So this is the manual we developed as a team. So as a team, as I said, these are the members of the team. We met from two different universities, University of Rwanda and the University of College Leuven-Limburg in Belgium. So we discussed how we discussed on those findings from baseline surveys, focus group interviews, networking event, and literature review, so that to know where to start developing our manual. Then after developing our manual, so the next step, the following step was just to train University of Rwanda students from School of Nursing and Midwifery as trained facilitators, as the aim of the project, as I said, was to equip future healthcare professionals in terms of peer education programs implementation, as well as also to empower them to be involved in community activities. So that's why we chose to use this methodology of training students from midwifery and nursing to be trained facilitators. After these are the different training the workshops that took place at the University of Rwanda to train these students to be trained facilitators. Then these trained facilitators, they trained peers in high school. So we had 8 students from each, 16 students from each school, 8 boys and 8 girls in different age. We see that. Then these students from School of Nursing and Midwifery trained peers in Kirehe district. These are the workshops when students from the University of Rwanda were training peers in different schools. Then these peers in each school, they started in 3 secondary schools. I can mention their names. It was Rusumo High School, Nyakarambi High School, and Pezana Air. So we had initially we had 3 schools, and we have 16 peer educators in each school. So these peer educators were supposed to train other students. So the rationale is that normally when it comes to SRH topics, students prefer talking this with their colleagues. However, their colleagues do not have accurate information. So it was our purpose just to train peers who would be accessible to their colleagues in their daily activities and everyday life, so that they inform them about accurate information regarding SRH. So these are the activities. Peer education manual then was developed. We trained students from the School of Nursing and Midwifery as on module A, and then we trained peer educators on module B, then also peer education program implementation. Then the outcome, first of all, at the end of the project, there was a decreased number of adolescent pregnancies. We didn't conduct these surveys, but we conducted interviews with the directors of the schools who have reported that during these past 2 years when we were implementing these peer education programs, there was no teenage pregnancy at the school, while they used to have 5 cases each year at least. So there was an increase of knowledge on SRH in Kirehe adolescents, as well as improved attitudes on SRH. Then, as a long term of this, or the sustainability of our initiative, these are the activities that we had to translate the peer education program into curricula. Now it is being used in community midwifery at the University of Rwanda. We also trained a big number of students, the final year students, so that they will be graduated already to teach communities, adolescents especially, using peer education program, as well as also involving staff at the University of Rwanda. So briefly, I can go through the results we brought on when we developing evidence-based practice. So from the focus group interview, this was the main question: how do 15 to 19 years old teenagers in the Kirehe district in Rwanda view peer-to-peer education in the context of SRH as a prevention strategy for teenage pregnancies? So what were the important conditions and expectations for a good SRH education program and a good peer according to these teenagers? So the social demographic, as I said, we had 16 students, eight boys, 8 girls. At Rusumo High School, we recruited 15 years old adolescents, Paisana age 16 to 17, then Nyakarambi 18 to 19. So we wanted to have diverse age in different schools. We didn't have any rationale behind why this school we took this age and this one. So these are the themes that were emerged. We identified after analysis for focused group discussions. So the first theme was attitude about SRH education. So during our interview, we found that at that time, adolescents from focus group had positive feelings about SRH topics. They also were curious and open to know more. And also another findings that youngest girls aged 15 were more afraid, shy, and anxious of talking about SRH topic. The participants also reported that they wanted more frequent education on SRH to have more knowledge and skills about SRH, and as well as they reported that they trust their peers and parents. So, for example, this quote illustrated attitude about eagerness to run about SRH. We need more knowledge that will allow us to prevent ourselves. Another theme that was identified was peer-to-peer education. So students reported that peer-to-peer education was a new concept to them. However, they reported also positive attitudes after knowing the concept. They even said that it was a good concept, and they couldn't wait to learn more about peer education program and how to work for their schools. So few of the participants reported that they were not open for peer-to-peer education program because a peer has almost the same age and has no experience. These are the findings the students had before. They were not trusting their colleagues. They would say, oh, they don't have experience. They don't have more knowledge compared to what we know. So another theme was perceived social norms. So the students were mainly were aware of the outcomes of teenage pregnancy, so these consequences, and also their disadvantages and bad outcomes. What happens? We see some of them in the tables below. So, for example, these are the quotes illustrating how the adolescent felt about the consequences, perceived social norms when it comes to teenage pregnancy. Her family is ashamed and disrespects her. So society starts hating and mistreating her. The baby is affected, and where situation like diseases. And the other one said, becoming unexpectedly pregnant isn't good. You have to quit studies. So the teenagers in the Rwandan context also they share that culture had no influence and played no role concerning these teenage pregnancies. I don't see any influence of our culture in teenage pregnancies because our government does everything to teach us how to avoid the unexpected pregnancies and to respect our bodies. Then another theme was perceived behavioral control and self-efficacy. So there was lack of knowledge on different contraceptive methods, and also the majority of the teenagers only knew condoms and pills as the methods of contraception. So one said, then if I can get money, go to buy condoms, they will laugh at me because I'm an adolescent. This is the perceived stigma of accessing some contraceptives. The concept sugar daddy came up in often in the interviews, which was also informed us to be a central topic when developing a manual. So the participants defined sugar daddy as an older man who asked for sex in return for money. It has also students reported that it has a major impact on teenage pregnancies. For example, this quote says, nowadays there are people who we call sugar daddies. They buy nice shoes and fancy dresses and other small items. When a girl receives such presents, she will feel like she needs to give something back. Men can also ask sex in return. It's crucial to give such kind of information on time to enable the prevention of the unexpected pregnancies. Another theme that was identified was SRH education. Most of the participants mentioned that they first talked about, they had the occasion of talking about sexual topics, prevention of disease, family planning, living standards, etc. And they also mentioned that the main sources of SRH information, for example, was from peers, teachers, parents, library books, and healthcare professionals. For example, after the teachers gave us information about SRH topics, I was very curious and somehow crazy to talk about it. Most of us were doing media research and pornography. These are the quotes illustrating how they get, where they get knowledge and how they discuss SRH topics with their colleagues. We do not have sufficient information. There are many things we do not know, like the process of fertilization or emergency contraception methods. Another theme that was identified was facilitator, like as a peer education program. So teenagers find it easy to discuss with their peers. This is even highlighted in the literature that is very helpful, and they respect each other and they have the same language. So some girls in focus group discussion preferred to being informed by peers of the same gender, because they thought this is what they said, not maybe they said that boys are not serious and sometimes exaggerate and laugh and lie too much. This is what the girls mentioned in their interviews. Again, boys from focus group discussion too reported that to them it was very difficult to communicate and have deep conversations with girls, so from the same age, due to the girls being shyer. So this is a gendered experience in our findings. According to me, if my peer is teaching me about something like reproductive system, I agree because he's trained, he can teach the knowledge he has. These are the quotes again. For example, this one said, "It is good to have peer. I will listen to her because we are in the same generation. I will understand quickly. I will be able to tell her all the problems that I have and feel free. She can advise me. I fear when it is an older person who teaches me." Teenagers said also reported that they feel more free and comfortable with their friends than discussing SRH topics with parents or teachers. For example, this quote illustrates that we can trust that information from the teachers, but they are not enough. For example, the teacher gives us the information that what is reproductive health, the definition, but we don't know any additional information of critical consequences about the effects, etc. So barriers in the intention to behaviors. So to behavior, the participant, for example, they say that peer education about SRH can help to prevent teenage pregnancies with increasing knowledge around preventive behavior on safe sex and the use of contraceptive. One of the factors that can contribute to disease and teenage pregnancies is poverty. For instance, when the family is poor, a girl from that family can accept to have sex with some because she wants money. So they say that when it comes to peer education programs, that would be an important avenue to discuss these issues that lead girls to such risky behaviors. So these are also tables illustrating main ideas we use to develop our peer education program. These are the causes the study participants reported, and the sugar daddy was alerting because it was mostly girls and even boys reported sugar daddy as a main factor of teenage pregnancies, as defined as an older adult who takes advantages on young girls, especially from low socioeconomic families. These are other causes, but these are known in literature. So sugar daddy was something that we had to highlight in our manual so that we would inform these young stars about what is happening out there. So the outcomes also, these are highlighted in the literature. For example, bad image in the society, in the community, loss of respect, poverty, drop off in the school, overpopulation, but suicide, it's something that adolescent the study participants reported, and they made us to think more about this one and to keep reminding them that this is happening in our society, so they should pay attention. So then prevention measures, these adolescents, they had several prevention measures such as contraceptive use. They knew about peer after being explained about peer-to-peer. This is something they said we should also learn about peer education programs and see how they work. So other ones they mentioned, we know them, all of us believe in culture, focus on future, no alcohol consumptions and group discussions. So about knowledge on SRH topics, these are different topics adolescent mothers say that they know, even though they do not have too much information, but at least they know, they can say they can just highlight preventive measures of teenage pregnancies. They can at least know about this concepts, sexual intercourse, teenage pregnancies, anatomy and physiology, menstrual cycle, sugar daddies, prostitution. So these are the things that they kept saying that they know, at least even though they didn't have too much information, but they know they knew the basics. When asked what they want, they want us to include in the peer education program. So they said these topics, they reported just to include abortion, adolescent stage, and this information of age allowed to have sex. So this is the thing mostly all of them were saying, which show that they had confusions. So everyone was saying, oh, we want to know which is appropriate age of having sex. So these are the topics: menstrual cycle, pregnancy, reproduction, sexual intercourse, and how to do it, sexual transmitted diseases and infections. So when we developed our manual, we made sure that we include everything here in our case scenarios so that they could have more information. So we also, because I wanted to recruit peer educators, we asked them to describe a perfect peer, how a perfect peer would look like. So they mentioned that they wanted someone who is confident, serious, intelligent, and disciplined, and also purpose, who had purpose, a decision maker, and a future making in life, a hardworking one, an honest, true, trustful, open-minded. All of these ones, these are the things that they mentioned, that they want peer educators those ones to be selected to have these attributes, these features. Then still, so we conducted our baseline survey in February 2020. If you remember, that was a month before, prior to the COVID-19 pandemic. So then we developed peer education manual. We trained UR staff, and also midwifery and nursing students, as well as also training peer educators on module B. So the intervention was conducted, this peer education program, between April 21 to May 22. It was supposed to start in May 2020, but because of the COVID-19 and school closures, we could not do that. So that's why we waited until this the students resumed their studies. Then the post survey, this is where we are. So we conducted pre and post evaluations. All those surveys we conducted before were about informing the development of our peer education. Now it's the phase of evaluating the implementation. So as I said, our intervention was supposed to be implemented in 3 secondary schools. However, the third school, Pezana Air, they did not implement the peer education programs because of the challenges they faced, such as repatriation of the peer educators who were Burundians to their countries. So they could not implement the peer education programs, and their mentors also were relocated to other schools. So that's why you'll be finding that in the baseline we have 3 schools, then post-test we have 3 schools in the baseline and then 2 schools in the post-test. Then, so for the, we had more females than males, and also many of them were from, in the baseline were from senior 3, but when we come for in post-test, we found them in senior 4. Then, sources of information when it comes to puberty, there was an increase after our intervention. So this descriptive statistics showed generally a slight increase because we were comparing 3 schools against 2. But when it comes to comparing only to the results from 2 schools, it is significantly improved knowledge and attitudes about SRH. Sources of information on SRH, they say that they prefer mainly school teacher, and when it comes to parents, they prefer discussing this with their mothers. This was just the same from baseline and post-test. Even though after post-test, it was an increase for when it comes to the mother discussing this, same on as the sources of information when it comes to relationships. So they always want to discuss this with school teachers, mothers, or friends, peers. When it comes to puberty, preferred sources of information, they still mention mothers and the healthcare professionals. This is the same. Then when discussing relationships between them and their colleagues, so for example, couples, so they also mentioned their parents, especially mother, discussing this with them or discussing with their peers. So condom use can be used more than once. Interestingly, there was no change in post and in baseline and post survey regarding this answer, because 79.4 said they disagree, and it was the same result in the post test. So condoms are effective for protecting against HIV/AIDS. So same in the baseline survey and post survey, there was a slight change. It would be embarrassing to buy condoms. So in the baseline survey, they said 46 said they disagree, and post surveyed was 45%. Condoms reduce sexual pressure, so there was also no change between baseline and post test. So condoms can slip off and disappear in the woman. So in the baseline survey, 67.5% agreed on that, and also in the post survey, 67.3% still agreed on that. So which means that there was no change regarding the information they have, even these ones. So as I said, it's because we're comparing, we also have results comparing two schools and see what's happened. So about AIDS and sexual transmitted diseases, this is what we had. There was a change from baseline survey to post survey. So the knowledge in HIV, the knowledge had significantly improved for all statements except for two questions under subscale of HIV/AIDS and STDs, which were HIV/AIDS and availability of simple tests for HIV. So as you see, for the p-values, were also for all these statements were significant, after performing these information statistics, they were significant. So also the effect of SRH peer education program on knowledge and attitude towards sexual health and contraceptives, that was also it was also increased knowledge and attitudes, same as the social demographic. Only students who study in senior 5 and senior 6 had improved their knowledge in SRH, but this is dependent on maybe on several factors, the long-term exposure to SRH knowledge, as well as those ones who were taking biology courses in biochemistry options. So we also conducted a qualitative research to explore the experiences of trained peer educators. So these are the themes that were emerged. There were benefits such as improved peer educators' competencies. There was improved relationship with their peers, as well as society understanding. So this the peer educators said that their confidence was increased, and they also improved public speaking and communication skills. They mentioned that it was challenging in the beginning, talking about sexual issues. They were also bullied and labeled with names, being teased by their colleagues, saying that they are advertising sexual behaviors. But however, as it kept running, as the program kept running, so there was an understanding and also developed a positive relationship with their colleagues. They also had limited resources because of lack of materials, and sometimes the directors kept the materials in their offices, and when the parents needed them, the students needed them, they could not access at the time. There was time constraint, COVID-19 context, and also combining responsibilities with academic roles. These are the recommendations they provided peer educators just to provide a specific time, training, more trainings, as well as resources in our local language, in our mother tongue in Kinyarwanda. So these are the reasons we learned. We learned that there was a teamwork that helped us to improve to the success of the project, as well as constant communication. We saw that peer educators had the will and also several potentials to the improvement of the project. There are also stakeholders involvement. So the schools took there was ownership to the school levels, and also we wanted to explore qualitatively the experiences of other students towards peer educators and peer education programs. These are the challenges. We had COVID-19 context. We have religious institutions which could limit some informations. There of movement of students, especially those ones graduating and those changing the schools, and limited time for follow-up of motivating and motivating peers, as well as financial issues. Then these are the students who were providing their testimonies, and at the closing ceremonies of this project. And we had also data for data dissemination. We had 3 published papers and 2 under review, and also conference. We presented our project in 2 different conferences. So this is our team in the Belgium. Thank you very much. Questions and comments?
Thank you very much, Emma Kurunziza, for the insightful presentation. I think we all learned a lot, and we still have exactly 15 minutes to raise questions. So if you have a question, you can just unmute yourself and maybe put the camera on and ask a question. And during the presentation, some questions were also already raised in the chat. So if it's okay, I will maybe start with one of the questions that was asked in the chat. And the question comes from Jean, and he's asking, after a pregnancy, is there any chance to return to school? There was one element or one student who said one of the bad consequences of pregnancy is that you have to quit your studies, but is there a way to return to school? Is there a program for that?
Okay, thank you very much. Yeah, the government is trying its best to integrate this student back to school, so there is no barrier. So whenever the adolescent mother is ready to come to school, they receive her, and there are also available resources to help them.
Great. Is there anyone who would like to ask the question directly to Emma? Maybe another question from the chat was someone who said the situation or the issue of sugar daddies is quite problematic, and he's asking basically if there is not a role for the parents as well. Does that not exceed a role for the peers, but is it not necessary for parents to intervene as well? And sorry, after that I will allow Innocent and Isaac to intervene. But maybe can you address this question first? What's the role of the parents in the situation of sugar daddies?
Well, thank you very much. Different literatures highlight that there is still a problem, still a taboo for some families to discuss about SRH topics with their adolescents. So, which means that if they are not discussing, of course, this issue won't be addressed. They won't discuss about these sugar daddies. Maybe if they do it, sometimes they do it informally, which is something also the parents have to work on. So to take it serious. It's a serious concern because it was highlighted by most of the adolescents that these teenage pregnancies, mostly for those ones from poor families, if I can say low income families, are related to sugar daddies. So the roles of parents is just take it serious and discuss, make it a central topic when discussing about SRH. However, I don't have, the literature also says that there's not that avenue of discussing SRH topics between adolescents and their families. If there is anyone in the audience who can just add what they know about this concern of sugar daddies, is highly welcome.
Okay, thank you, Amab. Innocent, feel free to raise your question. You can unmute yourself.
Yeah, thank you for according me the time to ask a question about this presentation done by Amab. I say, first of all, I say thank you for your best presentation for this term. And I'm very impressioned for this subject, your initiation, but I am very impressioned by this community talk to make barriers on prevention of adolescent pregnancies. I come to know, but I say sorry, but I am come late. I was in another meeting. That's why I can ask a few questions. Aimable said that you have done baseline survey and post test. I wanted to know when you plan to do a midterm or end the line, baseline. Donc, if you was done the baseline survey, in that case, you will go to do midterm survey. That's my first question. The second question, I come to know that you have done that survey on high secondary school students. Why you have focused on that high secondary school students in the whole country when there is other schools? That's my second question. Thank you.
Okay, thank you very much, Inosa, for your questions. If I understood well, the first question was about evaluation. So we did a pre and post evaluation. So before the implementation of the project and as well as at the end of the implementation of the project. So for the midterm, we only did qualitative studies to explore the challenges that peer educators were facing at that time. We interviewed, of course, students, peer educators, and key informants, their teachers, their mentors, the school authorities to actually rule out some challenges and also the needs, as it's like also to know what they wanted us to help for. So that then something came up, it was that they needed more training. So the project also trained, again, we went there to train peer educators. For the second question, this project, as I started saying, it was only targeting students aged between 15 to 19 years. So as the recommendation, we found that this peer education program can be adapted to other schools, to other age group. Why not? So this is for future research. Thank you so much.
Yeah.
Thank you for the questions, Innocent, and for the answers, Aimable. Also to Olive, who is answering some questions in the chat. I would like to give the floor to Isaac, who also has a question.
Thank you very much. And I'm Isaac. I'm working from Mezo Shalom. And actually, I'm working here in the Mahama camp. And I was very interested with this subject and the research findings because, first of all, we are one of the population which the research focused on, and we work with actually this population because more than 60% of the population we have in this camp are actually young adults under the age of 30 years old. So I was interested with the findings, and actually I want to thank the team for conducting this research. So I want to come back on this model, the model peer education model that had been developed. From a point of view, this is something that was very important, that's needed, but that need to be adapted on the, let me say, the context, the local context to ensure that let me say that actually either peer educators or other users might be able to use it and actually to transmit the message to the beneficiaries. So my concern, let me say, first of all, give message as an advocate. First of all, I will suggest to the group to meet with the other partners implementing, organization implementing in this camp, and maybe share with them these findings, and if possible, find other, because we have organizations that work in protection and on SRH education, so that sharing with this experience and the model might be an added value or a contribution to continue to provide to help to support these young people to increase their knowledge about SRH. My second mention is that actually in this camp we have these cases, because there are many interveners in these camps, but actually most of times we have young people who dropped out of the school due to the undesired pregnancies, premature, and actually they are in this age between 15 and 19. Actually, most of times they are dropping out. There are actually some of them who have even the chance to go to the boarding schools, because many of them study in a day school, but those who actually can have good performance are likely to get to go in other schools outside, but the rate of those who drop out before in 1 year is very high and alarming, because some of them got pregnancies in the middle of the journey before even finalizing their actually high schools. So actually from my suggestion is to find, actually, if the team might get opportunity to have more discussions, or the way forward for the implementation or the use of this model might be very helpful. Thank you very much.
Okay, thank you very much, Isaac. That's something we thought about. Thank you for your ideas and insightful ideas. So this is something that we thought about. We also want to continue implementing this program in other areas. So if it becomes possible, if you find means, so that's something that we are prioritizing. So the other thing, someone in the chat asked that trained peer educators are graduating, others are changing schools. So they were asking themselves the ways of sustainability of this program. So that's also a challenge we faced, but to solve that, we distributed enough materials, enough peer education manuals at each school, and also we trained peer educators and also teachers to induct other newcomers, new students, so that they can help, they can continuously help. Probably it won't be the same, but at least we gave them soft copies, hard copies, and the other materials to continue working on that.
Thank you, Isaac, for your question. Unfortunately, we only have 2 minutes left. I have questions that were raised before. I will ask them together. There are 2 questions. One is, did you also investigate the role of religion on the prevention of teenager pregnancies? And the second one is, sorry, maybe you can already answer this one. Yeah.
Oh, you said religion?
Religion, yeah.
Yeah, religion. Yeah, this is something that we explored first in the networking event. So we invited religious people to let us know the best way or the appropriate way we could implement this. So they provided ways, and we found that it's okay. They were not a problem to us. So we could actually implement our project normally. So there was no problem.
Okay, thank you. And the second question is, did the research also include pregnant girls and young mothers, or was the research focused on the prevention of it?
So ours was targeting prevention. So we could not eliminate if there was in peer educators an adolescent mother, we would not exclude them, but unfortunately, we didn't have one, but there were no barriers on such criteria. So if there was one, it would be helpful to our project because they would share insightful experiences. So we didn't have one. But mainly our project was focusing on the prevention.
Okay, I think that's very clear. I think and I hope we answered all the questions. Unfortunately, our time this was all the time we had. So I would really like to thank the audience to attend this community talk and for your participation. It's always a great pleasure to have you with us. And also special thanks to Aimable Nkurunziza and his team for the wonderful and insightful presentation and for sharing all your experience. And also a special thanks to Olive, who was busy in the chat answering and addressing all the questions. So we really highly appreciate it, and I believe we all learned a lot. I would also like to take this opportunity to invite you to the next community talk that will take place in September 27th on Klimmich Health. The research will be on the interaction between climate change, migration, and health. So very promising as well. So thank you all. Have a wonderful day and hope to see you at the next community talk. Take care. Bye.